I am Dr. S.K. Thakur, Senior Consultant in Gastroenterology, practicing in South Delhi. Today, the topic for our discussion is a very common problem in clinical practice, and that is gastroesophageal reflux disease, which is very well known to most of you as GERD or abbreviated as GERD.
Okay. So first question, what is acidity and what is the medical term for it?
Acidity basically is a condition that is described by most of us as a feeling of burning in the chest. This basically means when the acid from the stomach, which is normal, moves into its abnormal location, that is the food pipe or the esophagus. That term is used to describe acidity.
And sir, what is the medical term for it?
The medical term, as I told you, for acidity in the introduction is gastroesophageal reflux, which is a self-explanatory term. Gastro means from the stomach, the contents move in the reverse direction into the food pipe, which is the esophagus. So the medical term is gastroesophageal reflux.
Sir, what are the common symptoms of GERD?
The commonest symptom of GERD, which now I'll be using as abbreviation for gastroesophageal reflux disease, is basically heartburn. The term actually is a misnomer because it is nothing to do with the heart. But for most of us, we must understand that it is a burning sensation in the center of the chest. And since this is the place where the heart is situated, it is described as heartburn. That is the most common symptom of GERD. The second equally important term, complication or the symptom for GERD is regurgitation, whereby the food contents, after having entered the stomach, move in a reverse direction into the food pipe. So basically the two most common symptoms of GERD are heartburn and regurgitation.
Sir, third question, does stress or diet increases symptoms?
I think this question is very relevant because today GERD is considered to be a lifestyle related disease, and hence the question that is stress related to GERD, the answer is stress is a very important trigger for gastroesophageal reflux and heartburn. And we get many patients in our clinical practice today who come and tell us that they get heartburn and they have noticed it during periods of stress, and that is aggravating the symptoms. The second is on food. It is very important that certain types of food items which are a part of our day-to-day diet aggravate the symptoms of GERD because they cause a loosening of the tone of the washer, which is supposed to be protecting the upward movement of acid. So there are foods which we will be discussing subsequently when we talk of the management.
Okay. Sir, if one person is having acidity, so can the fasting worsen the symptoms?
Interestingly, fasting is a common phenomenon that has been observed among the general population, and it is more in ladies than in the male population. When we are fasting for a long time, there is a fair amount of acid in the stomach which is lying unneutralized by food because we are missing a meal. And this acid increases in quantity and its concentration and moves upward into the food pipe, aggravating heartburn and regurgitation. So therefore, the answer is fasting is an important trigger for GERD.
Sir, does acidity leads to any serious outcomes?
Acidity generally gives rise to temporary and self-remitting symptoms. However, in those individuals where acidity continues for days, months and even years, it is very well known that it is likely to injure the food pipe, its mucous lining, and there are complications like esophagitis, that is inflammation of the food pipe, narrowing of the food pipe called esophageal strictures, change in the lining of the food pipe called Barrett's esophagus, and even untreated, ignored acidity over years is known to be a cause for cancer of the food pipe.
Sir, can a patient reduce the symptom without medication?
I think this is a very important question, where acidity is such a common phenomenon among the general population in our day-to-day lives that there are certain measures which should be told to everyone so that they can tackle for themselves the symptoms of GERD rather than moving to a clinician or a hospital for treatment. The most important thing is lifestyle. The triggers for gastroesophageal reflux are excessive tea, excessive coffee, tobacco in any form, whether you're smoking or chewing tobacco, alcohol in more than normal amounts taken over a long term, heavy meals. People who take heavy meals and then go to bed due to the late meal, and the gap between eating and lying down when the effect of gravity is lost is less than 2 to 2.5 hours. We need to modify these factors, and stress, as I mentioned earlier, is a very important factor. So if these things like excessive tea, coffee, tobacco, alcohol, stress, heavy meals, and the gap between meals and sleeping can be modified, I think a lot of us can manage and tackle the symptoms of gastroesophageal reflux on our own. And here I would like to mention that obesity or increase in weight is a very important trigger. So weight management, which is within the hands of the patient himself, should also not be overlooked.
Okay, so final question. Does every patient require endoscopy to treat the GERD?
Today it is very well known that endoscopy is the gold standard test for diagnosing and treating patients who have GERD. I personally believe and recommend that every patient who has gastroesophageal reflux disease does not require an upper GI endoscopy. And most of us know basically endoscopy is when a tube with a camera at its tip is made to be swallowed by the patient, and the inside of the food pipe and the stomach is projected on a video camera which can be seen and recorded. Most of us can manage our symptoms of gastroesophageal reflux through the simple measures that I have told: lifestyle, diet, physical activity. If, however, the symptoms of gastroesophageal reflux on self-management persist, they don't settle down, or if they are recurrent, or if the duration of the symptoms is very long, then I would advise that the person who is suffering from acidity should go to his physician or his gastroenterologist, and then the decision to do an upper GI endoscopy or not is dependent on the gastroenterologist, who through his experience will decide whether he should do the procedure or put the patient straight away on medical therapy. Because today medicines are available which are very safe, very effective, economical, which can help you in treating your symptoms of gastroesophageal reflux disease. Thank you very much, and I hope that the information that I have provided on this very common symptom in our day-to-day life, you benefit from it, and most of us should be aware of it, because gastroesophageal reflux can often be confused with symptoms of heart ailment, and once you are aware of it, you can tackle it yourself and know wisely when to consult your physician. Thank you very much.